The National Institute for Communicable Diseases says delays have been reported in testing of mumps. It says current data does not allow it to measure the exact number of positive cases in the country currently. The NICD's Nevahsan Govender joins us tonight to talk about the situation. A very good evening to you, sir. Grateful for your time. What has led to these delays? What are the causes?
So there are many competing priorities at the moment. There's a lot going on within the health sphere at present, and mumps is generally not diagnosed using a laboratory test. It's diagnosed by signs and symptoms, and the capture of the laboratory test and the resulting has a longer turnaround time, because it's not as much of a priority. It's still really important for clinicians to have a high suspicion index of suspicion, and to keep mumps as a differential diagnosis, and to be able to diagnose based on the signs and symptoms. The laboratory test is merely confirmation of what is being observed by the clinician, what the symptoms that the patient is presenting with.
Does the lack of up-to-date information on just the spread of mumps at this point put any of us at increased danger, perhaps, of also becoming ill?
So, that's a great question, and I think I've spoken previously about mumps being generally a mild childhood disease. The reason we're having this outbreak at the moment could be as a result of the decreased socialization over the last few years because of the COVID-19 lockdown measures, as well as the impact on immunity for mumps. We've seen it play out in terms of the other vaccine preventable disease outbreaks, and so there's an possible immunity gap. And so people just being aware that there is there are an increased number of mumps cases at the moment, being certain of the signs and symptoms, being able to report to their physician or their doctor as soon as they present with the signs and symptoms. That is the best way forward. We have spoken much about how it can be prevented by having really good personal hygiene. The case numbers are greatest amongst your 5 to 9 year olds, so in your younger age groups, less than 15, and really encouraging them, to be well aware of their hygiene practices, sneezing into their elbows, washing their hands. The mumps is the mechanism in which it's spread can then be alleviated by those good practices. So does it put everybody else at an increased risk? That's quite difficult to tell, but we can be a lot more responsible on our own.
What about treatment? Yes, most cases you were telling us aren't picked up through lab testing, but if a parent, for example, has a sick child and they believe it may be mumps, what should they do? Is it necessary to go to the doctor, or would an over-the-counter drug, I'm wondering, be able to help?
So for mumps treatment, it's just about managing the symptoms. Working with a healthcare provider is probably best to be able to effectively manage those symptoms. The fever, the pain, the initial presentation that may be like flu-like illness. It is best to be able to do that with the advice of a healthcare provider.
Nevahsan Govender from the NICD, good to speak to you, sir. Thank you for your time.